George gauge is a relatively easy device to use. There are common misconceptions when taking a maximum protrusive and 60% protrusive bite. And this video will demonstrate proper techniques associated with utilizing the George gauge and attaining the correct 60% of maximum protrusive bite. The George gauge has two knobs, one located on the bottom portion of the tool and one on the top to retain the 5mm bite fork. The lower knob is used to adapt the unit to the mandibular incisors. You can see here how this lower blue component is mobile and moves freely over the lower teeth. Once the lower is adapted, we move on to the upper. Slide the appropriate bite fork into place and position it at the midline of the maxillary central incisors. The teeth should fit directly into the provided notch. Make sure the bite fork is loose in the George gauge, and it can easily be moved with light finger pressure. Have the patient go into their normal centric position. Next, have the patient slide their mandible as far forward as possible. This will dictate your maximum protrusive range. Repeat 3 or 4 times. Instruct your patient to be very comfortable and very fluid in the movements. Record the centric position and the maximum position as demonstrated here in this video. Now calculate 60% of the maximum range. Remember to account for the entire range of motion. Don't just subtract the two numbers. Notice on the George gauge it has a positive and negative portion. Multiply the entire range of motion by 0.6 and set the George gauge at 60% by tightening the knob on the upper arch. Use the putty as demonstrated in this video to capture the occlusal relationship. Remember to capture the last clinical crown to the anterior teeth. SomnoMed prefers not to adjust the vertical dimension from the provided occlusal relationship. Proper use of the George gauge will result in better wing-lug relationship, less premature posterior contacts, and a flat occlusal scheme.